Hello, PP1 students. This is Professor Marcus. At our next session, we're going to be joined by Health Sciences librarian Angela Lee, who's going to start to introduce you to some of the additional resources that pharmacists use in their daily practice that go beyond the drug compendia that you've become very familiar with. It's likely that you've already started asking yourself questions about the disease states that you're reading about and learning about in your coursework. Perhaps even wondering, what are the clinical implications? How are these decisions actually applied in real practice? So what we're going to be starting to do is introducing you to those other resources that you can use along with your compendia to answer questions like the one that's posed here. These questions can be really approached either from the drug standpoint or the disease standpoint. For example, in this question, you could focus on the dose of atenolol portion of this, use a drug compendia, and as you know, be able to pretty quickly find an answer. What you don't know in a question like this, if you're only using the drug approach, is whether atenolol is really the best drug for this purpose. And if we gave a response answering the question directly as far as the dose of atenolol, we may actually mislead or perhaps not treat the patient most appropriately if that isn't the drug of choice. So another approach would be to focus on the disease and think about if atenolol is a good choice for migraine prophylaxis. The downside of going just to a disease-based reference is it tends to have less detailed drug information like dosing, and it can take longer to find this type of answer than if we take the drug-based approach. So what's commonly done by pharmacists is to take the best of both worlds and looking at both a drug and a disease interface. So as we saw in the prior question, we could go down a drug route or a disease route, or we can try to find a resource that is the intersection of these two things. And this will be the focus of a lot of what we will start to show you in our session is you can choose, based on the question, which is more likely to answer your focus, whether that would be a drug-based or a disease-based reference, or if you're uncertain, you can choose a resource, a hybrid-type resource that actually has strengths in both areas. Some of the resources that we're going to introduce you to in our library are called Clinical Key, and it has an integration of a drug compendia in it. That's part of Gold Standard Media. Access Pharmacy, which is where some of your pharmacy textbooks are, also has a drugs tab. Facts and Comparisons, which you know as a compendia, also has access to a more disease-focused resource called the 5-Minute Clinical Consult. Micromedics has a disease-based resource built into it called the Disease Dex, so instead of typing in a drug in the search field here, you can actually type in a disease. And then probably the one that most pharmacy students end up getting very familiar with and using quite a lot is Up to Date, which has built into it a disease-based resource, links to guidelines, and LexiDrugs. In our time with Health Sciences librarian Angela Lee, she's going to show us these resources, and we're going to take some practice at starting to look up questions or diseases where we can see that interface of drug and disease. She has also prepared for you and is housed on our library webpage some study library guides that will basically help direct you to the best type of resource for certain types of questions that you have. So in this course, of course, we've been focusing on drug use, drug dosing, administration, and product information, but there's certainly many more drug information question types beyond that. She'll also introduce you to kind of the continuum of different resources that we have and whether they are more aligned with a drug type focus or a disease type focus, or again are kind of that intermediary type in the middle. So certainly you can put our references on a continuum from more drug-focused, as our drug compendia, the big three you've been using, to those that are more disease-focused, such as subspecialty textbooks for different areas of medicine, like oncology and emergency medicine. Here we have some of your familiar compendia, as well as some other ones you have access to, like AHFS Drug Information and Clinical Pharmacology. In the middle are our pharmacy therapeutics textbooks. Pharmacotherapy by DePiro is the primary one that you'll be using during your pharmacy training. And then over here on the right, you can see the examples of some specific medicine subspecialty texts. And in between the pharmacy-specific references, drug-based references, and medicine references are those hybrid ones that we mentioned previously, Clinical Key and UpToDate in particular. Resources can also be thought of in terms of how much depth they have. This will be another thing that we'll explore. And we can think about this again from the drug standpoint as far as which compendia have the most and the least depth of information. And likewise for disease-based resources, which ones tend to have more scope and depth that will help us answer our questions. So our goal for our time together will be to introduce you to some of these resources that you can start using this semester as you're going through your different disease-focused modules in pharmaceutical sciences, but you'll also continue to use these throughout your pharmacy career. See you on Tuesday.